where I went. Okay, well, we're just about there at 96. And somebody's already raised their hand and I haven't even started. That's great. Good. I hope that was a hello rather than a hand raised to call on you. So what's going to take place tonight, folks, is that this is a webinar, Zoom webinar. This is not a Zoom meeting. I think like most of you, if I had to attend another Zoom meeting, I would be Zoomed out for sure. So it's a Zoom webinar. Basically, you've got myself who will be presenting tonight. I've got a series of slides that I put together based on the 47 questions that were submitted when you guys registered for this presentation. So I'm just going to actually I built a presentation off of those. If you have questions tonight, please use the chat process. I can't see the chat while I'm sharing my screen. So we've got able help, namely Tammy Endow, will be helping to monitor the chat. What my request is that as I'm going through a subject is to, if you have any follow-up questions or additional questions with that subject, chat them in at that time. Because when I move down to another subject, going back to previous ones may be a little bit difficult because with over 100 people on, the chat could get long with a lot of questions. There will be a time at the very end of the presentation for us to just answer any other questions or topics that I did not get to. So just bear with us as we go through this process. Also, please bear with me. My voice is a little shot. It's been a lot of conversations over the last few days, so I'll try and hold up as best possible. So I'd like to welcome, and this is number one. Number one is health and safety. We hope that everybody that is out there that we're presenting to, that is joining us tonight, is safe, is healthy, is doing well. The same for their families, their children, everybody in the household. We just really do care about our members from top to bottom, and we just want to make sure that everybody is healthy and safe. In addition, a special call out for all of our members that are listening tonight, and those that aren't, those that we may know, that we live with, friends with, that are essential workers. These essential workers are everybody from hospital workers to lab workers to people in our grocery stores, delivery, postmen. I can go on and on, but just a huge thank you to all of those individuals that are basically keeping us safe, and we really do appreciate that. And I like to say that all of us are doing everything possible to do what we can do to keep you safe. So thank you very much to all of those folks. So you see here, kind of a little jigsaw puzzle. I don't know about you, but I've been doing a few of these lately. And this is peace, health, and safety. And what we're going to do is we're going to talk about several other pieces to the puzzle tonight. So I've taken the questions, I've categorized them as best possible, and I'm going to try and hit on as much of that content. After I'm done a section, I'm going to ask Tammy, do we have any other additional chat questions? At which point she'll read them off to me. I'll answer them as best possible. If we don't have an answer tonight, what we'll do is please email us so that we can get back to you with an answer if we don't have it tonight. And quite frankly, a lot of the questions that people are posting, we just simply don't have answers to yet. And we'll get to that in a second. So let's start off with the spring season. Massachusetts governor orders and the status. So up till now, we've been operating under the governor's assemblage orders and essential business orders, which expire on May 18th. And We will be getting an update on May 18th. If anybody has been watching the governor's daily news briefings, today of all, was another one where he said, you'll have to wait until Monday, May 18th. Now, he has done some preliminary announcements regarding some industries who could get back to work. For example, florists were permitted to do pickup outside and deliveries before Mother's Day. Golf courses, they've been permitted to open with a lot of restrictions. Just recently, also, the governor came out with these new phases, phase 1, 2, 3, 4, that he's given name to each of those. I believe the first one is named Start, and then we'll take it from there. So the first phase and what that means to everybody is going to be announced on Monday. What do we expect? It's run the gamut. Some people think, well, restaurants will be able to serve outdoors. People will be able to, dental practices will open, accounting offices, legal offices. What we expect to see mostly on the 18th is a reopening of a lot of businesses that are one-on-one type of situations, not large groups. The restaurants, of course, it'll be outside seating, and then physical distancing, social distancing will be maintained as a part of that. So what does this mean for soccer? Quite frankly, I wish I could tell you I had the exact answer. I have been a part of a task force that is a part of the Lieutenant Governor's reopening task force, and we've been meeting for the last 2 days, and we're giving as much information as possible for how we think things should take a look, with the first phase on May 18th, and then second phase and third phase. After that, it ends up at the governor's desk, Lieutenant Governor, the governor, Department of Public Health, the Secretary of the Health and Human Services. They're all going to get together, and they're going to try and determine what do they feel comfortable taking place specifically with youth sports. We don't have the answer as a part of this. All we can do is make recommendations, of which we've made some recommendations, hopefully that we could be a part of phase 1 on May 18th. Quite frankly, I'm just going to share with you, it's likely, but not, I should say it's highly unlikely, but possible. Our fingers are crossed. I'll get to more of that in a second with the dates. So that's where we stand right now. May 18th is going to be the big date of what's taking place. In anticipation of that, during the spring season, we run the ODP, we have the Town Select League and State Cup. All of these programs will have a decision made on to whether or not they will be continued after we hear the governor on May 18th, on Monday. We basically need to know, can we run these events for the total month of June? If we can't get a full June in, then these programs and these events will most likely, they'll be canceled for the remainder of the spring season for that program. And we'll just have to move on to what we can get started given the limitations that we have. So that's where we stand with ODP, Town Select League, and State Cup. We also received some questions regarding District Select program. District Select program, we have about 1,200 kids annually who play in it. It takes place the first weekend after July 4th, and it goes up to the first or second weekend of August. At this point in time, we are still keeping our fingers crossed that we may be able to have the District Select program run this spring. Once again, Monday's announcement will give us more direction on that. So that's what we're looking for. We are optimistic about activities starting in June or July with regards to soccer activities for sure. As we talk about this spring, another part of the spring is the adult registrations for the coming fall. So I'm going to get back to some more of the dates for the spring season in a second, but let me just talk about adult registration. Several people asked about what's taking place. First off, let me say this to all of our risk managers, registrars, other administrators out there. If we had to write the script differently with regards to what took place with adult registrations, we definitely would have written it differently. We made a decision to work with the company Stack Sports, move onto their platform last fall. And as we all know, a lot of things hit us at once, not only a change in platform, but then the change in safe sport registration process, the necessity for the abuse prevention training. A lot of things came out at us at once. And quite simply, it didn't work. And so we were looking to make things better when Stack Sports made the announcement that they bought Affinity, which was the platform that we were on prior for 3 years. So what's taking place there is starting in June. It's a perfect classic example of back to the future. We're going to transition to the new US Soccer Connect platform, still managed by Stack. They bought Affinity, and so they are building their new platform on the Affinity platform that we were on for 3 years prior to last fall. So was this last year a lost year when it came to registration systems? Quite frankly, if we knew what was going to happen back then, we would have made the change. But then again, if we knew what was going to be happening today with what we're dealing with, we would have done things differently as well. This soccer year has truly been an interesting one, to say the least. The nice thing about going back onto the Affinity platform is that it is a simplified process, just one website to go on to. There'll be one link, you log in. If you're a new registrant, you log in, you pull down the organization that you're affiliated with, you register, and everything's then managed by an administrator using the US Soccer Connect platform, which is basically the Affinity platform. They'll be able to take a look at where you are within the compliance management process. They'll take a look at where you are with your safe sport training, concussion certificate upload, background checks and CORI checks. And then if everything is in good shape, you're totally compliant, a credential will be able to be printed out. Mary Relic has been working nonstop on this. You know, it's, if as I said, if I could turn back time, we could have bought her a lot of hours in the transition, but we can't, but we're moving forward. We're pretty excited about this because the majority of our registrars that have been with us for more than a year are familiar with the Affinity platform, and it'll be a nice, easy transition back for them. There's going to be extensive training. There will be training videotapes. There will be learning aids, guides, you know, of screen prints, as well as a series of webinars that we're going to put together for the process. Some questions did come in with regards to the CORI verification process and COVID-19. Basically, when you complete the registration, you have to print out your CORI acknowledgement letter. The state of Massachusetts, the Commonwealth of Massachusetts, requires that you take that acknowledgement letter with an ID to the risk manager at your organization, of which then they will verify it's you. They'll go into the system, click you verified, and you're off and running. Well, we totally understand a lot of people really don't want to get that too close to people right now, and we appreciate that. So it is permissible right now to manage that process virtually. So if you have somebody who registers and they need to be verified, and by the way, verification is a one lifetime thing only, you don't have to do it every year, that you can do a Zoom call, a GoToMeet, a FaceTime with that person, check them out, see that they have the form, see their ID, then you can go in as a risk manager or registrar and click that that person is verified. You don't need to see them in person. What will happen is down the road is that when we are able to get out and you feel more comfortable, is that you have the person turn the form into you at that time as a backup, just so that you actually see the paper version. So we do have permission to use this process during this state of emergency. Who has access from the club or the town organization? The way we're setting it up is that the president, the registrar, and the risk manager, formerly the CORI submitter, will have initial access to the administration side of the system. And that if you would like to add anybody else on, let's say you're a large organization and you have multiple registrars or a risk manager assistant, then what we'll do is we'll have instructions on how you can go about adding an additional person on. Little bit of a commercial right here for the leadership report. The leadership report that is required with every registration submission must be completed so we know who these 3 individuals are. We still have several organizations that have not updated leadership reports for more than a year or 2. And so it's so important that the only way we can reach out to you, email you, give you this access is to make sure that that leadership report is kept up to date. After we get the system up and running and after we get everybody pretty much established, we're going to slowly work into activating an affiliation module within the US Soccer Connect platform, which then eventually will be able to sunset the leadership report, which means if you just have one person to change, you can go into the system, change that person's role, and that's it. We'll get a notification, everything will be all set, and then we can eventually do away with the leadership report. So that's something we're working on and we'll be testing. It's a brand new module that we'll be using. And then the player upload process for adult registrations is a streamlined process. It's very similar. You're going to have to just make sure everything's formatted correctly. The full instructions will be updated on the website when we put in all the fall registration information. And the format, the template, and everything's going to be there for you with regards to the adult registration process. So before I go on to return to play, Tammy, any questions about anything I've covered so far?
Yeah, we do have a few questions, Mike. The first one is from Kevin Brothers, and he says, he's asking, do we have a date in June?
I will get to that with these next set of slides, Kevin.
Okay. And then we have Mike Selstone. I'm assuming this is in regards to the registration process. Will this take place of and therefore negate anything done this past fall?
So that's a great question. This will replace, and then what we've been working on is that we've captured as much data as possible from all of the information that was uploaded into what they're referring to as the legacy US Soccer Connect system. And we're getting that populated into the new old system. So, so we're capturing as much data as possible. The majority of that data, of course, is going to be the background checks, the CORI expiration check dates. In addition, if you've taken Safe Sport, it's got a live API feed, which is updated like simultaneously with the Safe Sport database. So if you've taken Safe Sport, it'll capture that information as long as your email address is the same and the name is the same. So you won't have to upload that. The only other document that you probably upload will have to be a concussion certificate. And until we can get an API feed with the CDC system or another system, that's about the one that you'll need to update.
Okay, and the next question from Dana Rimmer. Where is the leadership forum and how can we access to update?
Oh, dear me. Hopefully you're brand new to your organization. On our website, under registration, there's a link there for the leadership report.
Okay, and Dana says he's the new president, so thank you very much.
Okay.
And Mike Sheedy was wondering if we have new players, first timers, how are they covered by the Mass Youth Soccer insurance if they've never played. Tryouts in
Right.
June or July would be their fall season, would be before their fall season insurance coverage.
And I will get to that.
Okay. And next from Jamie Mannix, is there a deadline by which adult registrars need to be verified?
Is there, so if adult registrars, meaning that, I guess the question is verified, it's a rolling process. Once somebody's identified by the organization as a president, registrar, a CORI submitter, or risk manager, we can give them access to the system. The leadership report will help us manage that.
Jamie just clarified, I think what they wanted was adult volunteers, not registrars.
Okay, adult volunteers, yes. The deadline is anytime before they step foot on a field. That's the deadline. So an adult, it's a rolling process. There's no deadline. It's always on. We typically will actually turn off the system in the springtime towards the end of the spring season so we can flip it over to start doing registrations for the next fall. So that's typically where we get, but by then we have 99% of everybody who's been registered that's involved through the spring anyway. And so it's turned on for next fall. But once we turn it on, it's rolling all the way up until we get into May of next year, and then we'll flip it off and go into June, which then it'll open it up for the following fall season.
The last question here is from Jose Isidro. Is there a deadline to put in the information before it sunsets? And you may have just covered that, but.
Yeah. So I'll touch on any activities that take place in June, July, and August with regards to where we currently are.
Okay. Is your CORI for DSP last summer acceptable for your club in the fall?
So the CORI is universal to all Mass Youth Soccer member organizations. So if you are CORI for one program or background check for one program, basically it's all Mass Youth Soccer activities. Just make sure that when you do your registration process that you're able to list secondary and tertiary third organizations that you're active with. So at least that's in the system.
Okay, I have another question in regards to the leadership report from Sandy Moore. If we have more board members than spaces on the leadership report, should we submit an additional form?
So here's what I'm going to say. Great question. Here's what I'm going to say. For right now, because we're going to be in a transition, just give us the core leaders: president, vice president, secretary, treasurer, CORI risk manager, just the named officers. As far as if you've got 24 others, don't worry about it. Just make sure that your local records are always kept up to date so that in the event we ever have an issue with officers, and directors insurance, that you have contemporaneous records locally of who all of your officers are. But for right now, on the leadership report, officers are fine.
I have a couple questions, Mike, that refer back to your first, your opening statements. I don't know
Sure.
if you want to take those now.
If I'm going to get to them, I'll just, like the others, I'll say I'll get to that.
Okay,
Yep.
Dave Doobie had asked, what exactly was the task force recommendations for the higher level authorities?
That's a great question. Tongue in cheek, our recommendation was full out play starting Monday. No holds barred. Let's go. No, quite frankly, I think, really wanted that. So our recommendation was, initially our first recommendation was during phase one, was to have, basically was to comply with all CDC and DPH assemblage requirements. So if it was 10, is to see if we can get 10 people out on the field, 9 people and a coach, take 9 players and a coach, taking care of everything possible. And that it would just be skill development only, physical distancing, the whole bit. and we got some resistance to that today. So we went back with that a little bit. I'll know more tomorrow. This thing is just it's a process where we work with government officials. They meet with there was a meeting of mayors done last night. They also met with the lieutenant governor and governor last night. They had another meeting with them tonight. We'll learn more tomorrow on and how close we are. So what we then did was we said, okay, if we can't get phase 1, let's be more aggressive with phase 2, meaning that see if we can get more people on a playing surface as possible. Playing surfaces being a single field. You know, for example, a concern that we had was, let's say you have let's say, for example, you have a 16-field facility and the limit was 25. Well, is it 25 to the whole facility or is it 25 per playing surface? And so we're trying to make sure we get it to playing surface. We have several organizations that have 3 hockey rinks under one roof, and they want to be able to have a set number of people playing hockey on a sheet of ice rather than the whole building. So these are it's back and forth. It's the I'll talk about it. Well, really, the key driving thing is the data. That's the governor is looking at the data, and that's why he's not making any announcements to the 18th, because he would like to get data for the next 5 days. And he wants to see the curve go down. He wants to see things taking place. He wants to see everybody practicing, the proper mitigation techniques. That's what the governor wants to see, because he could change his mind on Monday if we have a bad Friday, Saturday, Sunday. So that's where we're at.
Okay, and one last one right here. Is there a go, no-go date for district selects given the uncertainty?
That's a great question. We'll know more tomorrow, because the phases, what you have to realize is, for example, the committee we're on is also partnered up with committees that do fishing and hunting, boating, beach, ecotourism. I can go on and on. Is that what's going to happen is that every vertical, as the governor's referring to them as, will have their own phased in approach. So starting on May 18th, everybody's going to be starting the phased process. And so one vertical could be in phase 2, where another vertical is still in phase 1. And a great example of that are golf courses. Golf courses are pretty much in what they would consider to be phase 2. Right now, youth sports has to get to phase 1. So that's a lot of the things that are taking place, that from this point forward, we're not going to see certain dates. We're going to see the governor taking a look at all of these verticals, all these essentials and non-essential businesses, all of these facilities, everything individually. And then, there could be new announcements every day of what is being allowed to, turn on the light switch, what's being allowed to return to activities, return to play, return to business, return to worship, and so on and so on.
Mike, I thought that was the last one, but I do have one more. Jose just asked, in regards to our registration system, would we be able to, what he's looking to do, I'm sorry, is with Safe Sports, for the folks that are part of US Club as well as USYS, MS Youth, is there a way to carry over their Safe Sport registration from one system to the next so they don't have to do it twice?
Absolutely is. So there's two ways that can be addressed. The first way is, as long as they're in the Safe Sport system with the same email address, name, kind of data matching, what'll happen is that the new US Soccer Connect system will do an API lookup with Safe Sport, find the person, and update their data. As a test case, it worked for me. So that process will take place. If in fact it doesn't find it, we highly recommend that everybody, whenever they take any online course, that they save their PDF of their certificate. And so then what the person can do, if the API fee doesn't find them from SafeSport, it's real easy. They just go in, they upload their certificate, it'll read it, and then it'll identify, and then they'll be all set until the expiration. By the way, SafeSport is a yearly thing. So the initial course is good for that calendar year, and then the next year you have to take a refresher. So SafeSport isn't good for 2, 3, 4 years. It's every year it needs to be refreshed. All right, I'll move
on.
All right, return to play. I prefer return to soccer activities because a lot of times when talking in the network, especially now that we're talking to a lot of people at the State House, when you say, when you hear play, they think game. And so soccer activities captures that more. So the date was, this is me. This is not the state, folks. I'm a caveat. If the governor has an epiphany and says on May 18th, hey, let's go kick the ball, we are so lucky. My gut feel is we will have a return to soccer activities the second half of June. Okay, this first time out of the box, if you've looked at his charts that he has and you looked at all this everything, this first time out of the box, it states that certain businesses will allow to be restarted with severe restrictions. Well, having kids out there with severe restrictions is the governor's thinking, let's not have them out there at all. There's a lot of different factors to the governor and the lieutenant governor's decision process. So one of the other things we're advocating for, this gets back to one of the earlier questions about what do we advocate for, is that when we do get out there, we're getting out there for the sport to be played the way the sport's supposed to be played. So if we can't get going in a phase one that is a long period, and if it's till the middle of June, when we get going in June, we would like soccer to be played without physical distancing by the players. Early on, everybody thought it was going to look like what Idaho is doing right now. Idaho opened up on May 1st. They have limitations of 10, which is the whole state. I have friends in Idaho. Limited to 10, and they have to physical distance, which basically is a lot of individual skill building activities, which is what most of our children should be doing at home already. We've got them the Top Techers tools. We have the backyard games on our website for everybody to use. Lots of tools for you to use on our website. So the individual development should be taking place already. Idaho is, and I talked to them out there, they took the stance that the state said you can start May 1. Idaho Youth Soccer says, fine, we're going to wait 2 weeks. We're going to start on May 12th. They thought it was just too early to go back. And now they're back. And so, yes, the kids are getting together and everything. Folks, if you look at the Idaho stats or the Utah stats, the other states that are doing this, and compare them to the Massachusetts stats, we're not going to be getting out there as quickly as they did. And that's what's taking place. So we're pushing for, once we can get on the field, let's play the sport the way it's meant to be played. Primarily, it will be soccer activities, except league games and tournaments. That's something that's being discussed. So, but we'll be able to use the play, practice, play model when we're out there with our coaches. And if you're not familiar with it, shame on you. Please start your grassroots courses so that you can become familiar with the model, because you will have everything you need to get going. Okay? return to play must comply with all CDC, State Department of Public Health orders, local government limits and protocols. So when we return to play, yes, there's the CDC, and then we have the State Department of Public Health. You may have more restrictive orders in your local jurisdiction. One town may decide to limit activities compared to another town. How do they go about doing that? They could basically forbid permits to be issued until the town Board of Health says it's okay to issue permits. So there are ways that they can put in local limits and protocols, but so we're going to always need to comply with these when we return to play. Most likely soccer activities early on are going to be, and I talked about this, practices, skill development, tryouts, clinics, etc. I'll get more on tryouts later on as well, but no league games or tournaments early on. Later on, July, August, we're pushing our committees for league games. That would be in a later phase into July and August. That will help us determine what's going to happen, not only with the District Select program, but with other activities that we can help our towns and clubs arrange for summertime. And then return to play. Tournaments probably will not be freed up until the fall time, if this fall at all. The big issue there is a lot of the big tournaments, and when they hear about tournaments at the State House, they don't consider a XYZ Towns Columbus Day tournament where it's only town play. When they hear tournament in which they have to treat them all the same, they hear people flying in to play in showcases. And you have to remember, this isn't just soccer we're talking about. This is, the committee I'm on, we have representatives from soccer, lacrosse, softball, baseball, football, volleyball, ice hockey, ice skating, golf driving ranges, you name it. So these are, so they just can't say, well, you can hold a badminton tournament, but you can't hold a soccer tournament. So these are some of the things that will be worked on. But quite frankly, I think what this all does is it actually paints a rather encouraging picture, is that our children will be on fields of play, on courts, on tracks, in swimming pools. They'll be out there participating in youth sports, which is a huge, huge part of the therapeutic process that we're going to need to go through for not only the children, but also for the adults. So this is rather encouraging. The people that are on these subcommittees from the State House have children that play sports. One of the people from the committee that works at the State House has 2 kids that play soccer. And he can't wait to get out there. One of the kids can't wait to get out there with his soccer buddies. So they get it, they understand it, and they're trying to do everything. But the delicate balance is the stats. And the governor said when he rolled this out yesterday, if the stats get worse, somebody who was in phase 2 could go back to phase 1 like that. He's not going to be a hero when it comes to that business, but his focus is the health and well-being of the citizens of the state. So there you go. I just jumped ahead there. Also return to play. I'll go through this and then we'll get to some of the questions. The technical department is preparing guides, manuals, training. We'll have everything there to help you out. Guidelines for running practices and games, the what and the how, sanitization. If you can, get as much sanitizer as you can get your hands on, literally. Get what you can. PPE usage. Folks, we are not, it's not on the table. It's not being discussed. Athletes, players will not need to wear face masks or gloves. unless they're playing baseball, they get one. But they won't be, they're not going to have a face mask. Logistics, we're going to have guides and how-tos so that when you run a practice, if you are running practices that are stacked up or running sessions that are stacked up in one location, you might have to have a larger gap in between the time, so it gives enough people time to leave so the next group of people can enter. An egress and a digress, exit and exit areas that are separate, 6 feet apart, the logistics. So we're going to be working on providing you with a guide with guidelines on how to deal with all of this when the time comes, where that's being written as we speak, so that when we're ready to go out, you'll be getting it. In addition, I talked about session plans. If session plans do need to be revised for anything having to do with physical distancing, we're working on that. We're going to have them on the back burner. Our desire is we don't need them and we can use our play, practice, play session plans, which are currently up on our website. So we're preparing for many contingencies when it comes to return to play. So before I get on into summer, I'm sure we've got a few questions regarding return to play.
We do. I have one question then that goes back to the last conversation, so I just wanted to get that to
Sure.
you. Jamie Mannix was just asking, when is a refresher course for Safe Sport going to be available? And is the rollout for the training going to be more methodical than last year when all the courses were crashing?
So that's a great question. So first off, the refresher course, I took mine a year and a half ago. It's available. It's the second you enter January 1, you can take it. So the refresher course is available. You log into your Safe Sport account. It'll recognize what you've taken, and then you'll have a choice to take your refresher course. After you take the refresher course, you'll get an API feed into the new system, and your record will be updated. Crashing, unfortunately, the CDC was not the CDC, well, both CDC and Safe Sport, quite frankly, not equipped and ready for what's taking place. And we haven't heard any issues recently with the Safe Sport. It seems to be working fine. We haven't gotten many complaints. Mary would let me know. And then with the CDC, one of the changes is the CDC went to a whole new platform. So now you need to create an account and with the CDC. And when you take the course in the past, you just basically gave the CDC your name, you took the course, a certificate printed out with your name, and it was all paper-based. So one of the changes that's taking place is that you do need to create an account. And what we're hoping is in time, that will also API feed, data feed over to the system, and you won't have to worry about that as well.
Okay, I have a question from Mike Elster in regards to the return to play, and were spectators or parents mentioned with any return to play watching activity?
So yes. So what we're taking a look at, and once again, this is all part of the proposal process. It's been a give and go. And there were some organizations who said, listen, just have the parents drop off the kid and stay in the car. Well, unfortunately, well, you could recommend, but you can't require because state law says that any child at the age of 17 or younger, the parent has the right to observe their child at all times. So initially, the suggestion was, okay, so it's one spectator per child, meaning highly recommended that that spectator is a child guardian or such. Problem, single parents, 3 children, one plays, they have to watch the other 2 kids while they're watching that child. So now you have 3 people. So what it's going to come down to is what we recommended is no limits on spectators from the state, and that as long as they are physically distancing away from the playing surface, maintaining the 6 feet apart. So then that's what we're recommending. So, if you've got 18 kids out there playing and you could have 24 spectators, I should say playing, practicing, watching. Once we get to the games, I mean, we're talking no limits, but So that's what we're working on. Indoor facilities, what they were taking a look at, it was trying to copy, and I know, Mike, that's going to be a question of yours, is indoor facilities. They were trying to copy retail where it would be a percentage of public of capacity as established by the fire marshal. And once again, what we recommended is now that as long as everybody is properly physical distancing from each other, they can be considered a spectator.
And from Ken Truesdale, would a weekend friendly with a city or even between cities be considered a tournament or league game for purposes of when activities would be permitted, where friendly might be multiple games over a weekend, for example?
This was a subject that came up, and most of us decided to do a Sergeant Schultz on this one. I know the young kids don't know who that is. What we've submitted is that there are to be, it's practices, clinics, exercises, tryouts, assessments, whatever, but no league games or tournaments. The concern that they have is that that if there is going to be any type of scrimmage, that it's a part of the normal practice session. So it's highly unlikely we will have one town be able to scrimmage another town or a club versus a club with the initial phase of playing. They have there's some dramatic concerns from the governor about this type of cross population, where you could have one area that the numbers are just off the wall, and they decide to play a friendly with a team from another that comes on in. And so they're trying to, for now, keep everything local as much as possible. I probably didn't get the answer you wanted, but it's highly unlikely that we will have the ability to do crosstown friendlies.
Mike Elster was wondering, Mike, if there was any insight or if you've heard anything on high school sports for the fall.
Didn't touch it. That's an MIAA issue, and this youth council is strictly with youth sports, not attached to the MIA, and we stayed away from it purposely.
I have a question from Paul, and he was wondering if parents would be expected to pay for fall soccer, since it seems like it's a continuation from the spring.
That's an organization by organization decision of how they fall starts September 1, or now for some people it will start the last week of August. Some leagues do it, and that whatever takes place in the spring and moves to fall, that's an organization by organization decision.
Maria Mumby was wondering if we could recommend some companies or websites where we can buy industrial size hand sanitizer, and if there's a central buying office within Mass Youth.
So Maria, great question. We're asking the same thing. What we're doing is we're digging into our membership database, and people are sending us some information. Right now, where we are is we're getting some samples from some companies, because unfortunately not everything being made in somebody's garage is kosher. So we're trying to find the right sources. In addition, we're in contact with the State House with regards to some type of a bulk purchasing plan that they may bring out for municipalities, parks and recs, and for organizations such as ours.
The next question.
So
I'm sorry.
if anybody has a resource, reliable, good pricing, please email it up to us.
The next question comes from Robert Lee. If a family requires that a child wear a PPE, will there be accommodations for that?
So if a parent requires their child to wear, whether it's gloves, and/or a face mask. That's being looked into at this time. What we may need to do is identify certain types of face coverings that are safe for this, safe for play, because as we know, the key is if and there's been some discussion, is that a face mask that it goes over ear is preferred as to one that goes around the head, because if a finger or something gets caught in a face mask, close contact, the over ear can come off real easy, as compared to around the head, which can be dangerous. So we're taking a look at that if at that situation.
The next question is from Pete Tavera. What do you think the safety guidelines will be for the bathrooms / porta potties? And what will they be? And for example, are bathrooms still going to be required to be open at all game locations? Challenge, how can we ensure cleanliness for each use?
So first off, the bathrooms being available at all game locations is a league by league decision. It's not a Mass Youth Soccer decision, nor is it a Department of Public Health requirement. So what we see in discussions with the other sports is that most likely what will take place, and it could be depending on the phases that we're getting into, is that that certain places will not have facilities, and if they do, they'll have somebody on hand who will need to go in, an employee or volunteer who will be properly dressed with the PPE, and that they would go in and they would wipe down after every use. The other part of that is when it comes to porta potties, it's just basically it's posting signs, use at your own risk. So people may go in ahead of time, prepare it themselves, take care of what they need to do, and then when they leave, the next person would have to do the same thing. But having a facility is not a requirement of Mass Youth Soccer. It's typically a league requirement that's what they would like.
Okay, Skip Dennis was wondering if they could allow spectators behind the goal if sidelines get too crowded.
So that is one of the thinking is to expand the spectator area. So because a lot of it has to do with your first spectator line. And so what's being looked at is some schematics that we can share, and then having spectators sit at a certain distance behind a goal is looked at for being permitted so that everybody could be there to watch. But another thing that we're going to be asking a lot of organizations to do is to limit the spectators. As we get into when we get into the game phase, and is to just do your best to limit spectators. We're taking a look at ours, coming up with semi-permanent HiPods for live streaming or videotaping for replay later. There's a lot of different things we're looking at so that grandmom and grandpa can watch the grandchildren play rather than go to a complex or to a field and the such. But yeah, so you'll see some schematics where you have a spectator line, hash marks every 6 feet on one half of the field, or you could have hash marks every 6 feet for a quarter, then every 10 feet for family clustering, and then 6 and then 10, and then one line 6 feet behind that, staggered off so they have a clear view of the field once again, and then wrapping around the backs of the goals as needed.
The next question coming from Aaron Tolios. If there's a breakout of virus traced to one of our programs, do we have a crisis management plan in place to help the organization?
I'll get to that a little later on.
Okay. Susan Ruff is asking if we've considered extending the fall/spring registrations through the fall season.
I'll get to that. I'm not worst. I'm kind of concentrating on on the return to play, the play part, the practice part, the activity part.
Mhm.
Yep.
And someone, Sharon Clement was wondering, some essential businesses are taking temperatures for admittance to an office space. Is there any discussion as a requirement for on-field players and coaches?
As a part of the plans that the state is putting together and what we're putting together, we're asking parents to do everything possible to make sure that your child is healthy to attend an event. We will not be taking temperatures at the fields. There's a whole litany of issues with that, both in a place of employment and the such. And the biggest one is that when you take somebody's temperature and record it, now you're basically taking personal information, and then you have to be compliant. And so opens up a whole new can of worms. So the recommendation from the attorneys is that have a protocol in place that parents will take their children's temperature, check any symptoms, check their health before taking the child to the fields. Got some people raising hands. I'm going to ask that they please use the chat function.
Okay, just kind of going through because we have a lot of questions here, but some of them we've touched upon. Here's one from Skip Dennis about masks. Again, most of the N95 masks go overhead, but hopefully it won't come to that level of protection. I like the injury question, but thinking more broadly, is Mass Youth Soccer having a top to bottom review of policies to determine which may need to be modified? If so, how quickly do we think this might happen?
Well, I guess the question is, when you say a top to bottom, if you're referring to an emergency action plan and to our procedures and processes, there's two different things here. Yeah, we're going to be following the state's protocols and guidelines that they are going to give to everybody with regards to return to business, return to play, return to activity, return to recreation and the such. So we're going to be relying on the state to provide us with the protocols, and then what we'll do is we will take that and we will be updating our Safe Soccer section of our website with this information.
Okay, I have a couple more here. Mike Sells is indicating that his league offers concessions during games. Has there been any discussion on that?
So with regards to concessions at a facility, the first thing is that concessions better have local Board of Health permission to be a concession stand. Okay? And then what's going to happen is that concession stand will be able to operate under what the local Board of Health will require, which then comes from the Department of Public Health. If you have a concession stand that you are running that is not approved by a local Department of Public Health, it's not a concession stand. And it should not be operated as one. And technically, people, I know you set up a table to sell stuff that you got at Costco or BJ's as a fundraiser. Technically, that's not supposed to be done unless you have a Department of Public Health permission from the Department of Health from the local town.
Okay, and the last one for this section would be, what will the process and timeline be for the governor to accept or reject these recommendations made by the task force?
That's a rolling calendar. We may find out on Monday where he stands with youth activities. Could be on Tuesday, Wednesday, Thursday. He could decide to do deep sea fishing, boating excursions, and spelunking before he decides soccer. So or youth sports. So I wish I could tell you. All right.
You can move on.
Okay. And we'll come back and catch anything that we missed. Not a problem. Okay. Summer, late June, July, August. Permitted soccer activities will be based on the phases that I spoke about earlier. And so, as this, as we learn more, we're going to have to match our activities to the phases that the governors reopen for business task force puts out there. So it's all going to be based on those phases that were put out. Camps. Camps are possible with restrictions. The camps are being dealt with by a totally separate committee, because we have a lot of organizations that have been running summer camps, both at campgrounds that they own, such as YMCA's, Boys and Girls Clubs, the Boys and Girls Scouts of America. They have their own properties that they do overnight camps, or some of them have where they do day camps. And so the restrictions, it's all going to come down to what the limits are for assemblage, and in addition to that, the certain protocols. When it comes to soccer camps, I wish I could give you an answer. If there is an assemblage limit during the summertime, meaning let's say it's 15, 20, 25, 30 people per playing surface, that's all you're going to get. And so is a camp provider going to be able to do that? Folks, I just don't see a lot of soccer camps taking place this summer. But it's very possible we could see a lot of soccer clinics taking place this summer. And for those of you that are done the camp business or a clinic, you know the difference. Camps have a very high benchmark of requirements that must be met. Soccer clinics, which is less hours per day, less days per week, have less restrictions. So we could see, if you've typically had an outside company come in to deliver at camp, we could see a change taking place. All right. Tryouts. We know a lot of organizations have a desire to hold tryouts. The best thing I can tell you is, number one, is to have a plan in place. Start thinking about it now and have several versions of the plan ready when it comes to tryouts. Don't just all of a sudden say, hey, we can get out in the field, let's throw some tryouts together. Because by then it could be too late. The kids are gone for the summer, they're not around. You can't get, I highly doubt anybody will be able to get every single child playing travel soccer together for a tryout before next September when the season starts. So a recommendation is that you only assess the players that need to be assessed. Take a look at your rosters and move the roster from one season to the next. If you've got a split team where it's 5th and 6th graders and the 6th are moving up to 7th, the 7th, 8th grade team's moving up, the 8th graders are moving into high school, so now you have new 6th and 7th. Take a look at best possible at all the data that you can collect to place the players appropriately. We have a lot of players that have moved into town. You've never seen them play before. Well, that's that's a one-off assessment that you should be able to run. Or if you've got a group that's coming out of in-town and going into travel for the first time, and you haven't had the opportunity, right, then that could be a group that you bring in for assessments in order to build the team for the fall. Our biggest recommendation is every organization should have an identified director of soccer development. If not, appoint one. If not, find the right person and have them consult with our technical department. So Ian, Loy, and Tommy, working with Tammy's management, they should be able to help answer any questions that you have about the best way to tackle your player assessments as a part of the tryout process. I'll get into a little bit of the question we had about insurance and stuff later on with regards to tryouts. it's highly likely that this may be the only soccer activity that a lot of organizations do between now and September. And that's okay. Some organizations are looking for a very, very active, if we can get out there in late June, but definitely July and August, try and do as much programming as possible. And others are looking at just bringing the rosters forward and just buttoning up the shop and not doing anything until practices start either the last week of August or the first week of September. So, but that's my recommendations for tryouts. Ian, I know you're on. If you want to mute, anything you want to add to this whole thing about tryouts?
Thanks, Mike. Nothing to add at this time. I definitely concur with the way that you've laid it out. Trying to furlough players and move them around, collecting that data and making sure that you are only really trying out players who are new to your organization and interested in playing. But please, please, please reach out to us with any questions you may have. We'd be happy to have a deeper conversation with you about it. So thanks for that, Mike.
Great, Ian. Thank you very much. Summer, still in the summer, Master Soccer summer activities. So the staff at Master Soccer, everybody from technical staff straight through everybody else, we're very optimistic that we will get our children outdoors kicking a soccer ball. And yes, there are going to be restrictions early on. It's going to be loosened up. Yes, we're all playing our part right now to bend that curve down, to give the governor the best stats possible so that we can get our kids out there. So one of the things that we're working on is, and if you haven't attended one already, shame on you, is our coaching conversations. These are actually, they're not webinars, they're active meetings that you participate in. On the Master Soccer website under coaching, you will see coaching conversations. We've got an active schedule and we plan to run those 2 to 3 a week, as long as we can. There's great topics. You might find one that's of interest to you. When you get on, be prepared to be active. Anytime you participate in something that our technical department is putting on, it's active involvement. It's not sitting back and having a cup of coffee and hiding. So, but those are incredible sessions. Coaching courses, the Federation. Right now, you can take coaching courses online. Take the grassroots courses if you haven't taken one already. Learn about the play, practice, play model. Get yourself educated. There's the 4B4, 7V7, 9V9, and 11V11. Get on those. And then once we have permission, which we're hoping starts on July 1 from the Federation, is live courses will be able to be scheduled, and our staff will be out there putting as many of those on as possible. So these are great summertime activities. Or actually, coaching courses, coaching conversation are activities for right now. What we're also taking a look at is soccer activity events. So if we can get out there, but if games aren't possible, is to try and coordinate various activities, whether they're held in a town, at a club, at a facility, or even at our facility, is to try and hold some soccer activity events that get the kids out, playing the game, kicking the ball, skill development, socialization, basically celebrating the sport as much as possible. And then when games are permitted, if we're able to get games up and going, is that we have plans to host festivals and jamborees at the facility, and or if we can get folks onto fields at different parts around the state to host various festivals and jamborees when games are permitted, so that we can get kids out there and active again. These are also going to be great activities that you could use as a part of the assessment process for tryouts as well. Once, and hopefully we will be able to be playing games and in all of July, if not part of July and August. Before I move on to insurance, Tammy, back to you.
The only question I had was in regards to DSP for the summer programs. And I know we touched on it earlier. I don't know if we want to touch on that again.
Is just the status of DSP is on hold until we have a good idea of what type of activities we'll be able to conduct in the summer. If we are limited on tryout capabilities, is that we just have all the administrators work with their coaches on building rosters based on previous year teams. And then as far as any new players, it could be an interview process, find out where they played in the past, the level that they played at, and so forth, and take it from there. A lot of coaches have used that process rather than tryouts for late ads and such. But you know, if our desire is that we will be able to play, it may have to be delayed. Let's say a week, maybe start in 2 weeks after July 4th, weekend after July 4th. And then we would just play 4 weekends and not have a tournament. I would say that the season-ending tournament is highly unlikely because of the gathering issues. So we're doing everything possible.
That's it for the summer questions, Mike.
All right. People still with me? I know. We're moving along here. Insurance. So I just want a quick little lessons about insurance. If you want to know about our insurance program, go to the Master Soccer website. Under administration, look under insurance. So a lot of people are saying, does our insurance cover COVID? And the answer to that is maybe. And I'll tell you why maybe. Our excess, we typically refer to it as an excess medical policy, but it's actually an excess accident policy, not illness. So our policy, the way it works, let's say a child, or even a coach for that matter, breaks their wrist. They go to the hospital. Our excess accident policy, by the way, they break it during a normal soccer activity, will cover, should cover that. And they put a claim, they have to put a notice of claim in within 30 days of it happening, and then they go through the claim process. And what we do is we reimburse basically any out-of-pocket expenses, which is co-pays and deductibles. So that's the excess accident policy. Doesn't cover illness. Doesn't, and it's never been that way. This is not a COVID thing. It's never been, it's an accident policy. Because illness, the big question with illness, and this is where we're getting to the next subject, is it is so difficult to determine where a participant contracted the illness. That's the difficult part, okay? But to make you feel hopefully more at ease, is that we have a general and excess liability policies in force. These protect us in the event of legal action or where we are liable and there's been no legal action, or there could be a settlement. But these policies are basically what protect us of that if it can be verified and traceable that somebody contracted coronavirus at one of our covered events and they would like, to take action against Masters Soccer, by all means, everybody has the right to do that. And we have these policies where it provides anywhere from $10 to $12 million of coverage. The general liability policies, if you equate it to many, you have a homeowners, which covers you up to $1 million, and then you have an umbrella at home, which could be $1 million, a $2 million, a $5 million umbrella. So our basic coverage is $2 million of basic, and we have a $10 million umbrella. So this is the plan that would be in place in the event that we have a coronavirus claim that is challenged, and pretty much the liability policy is what will protect us there. So that's the insurance that we have to protect us. I feel very comfortable compared to most other state associations that we have one of the most aggressive and all-encompassing insurance programs out there, bar none. So when I was talking to the other organizations, when they heard that we had a $10 million umbrella, really? We have a $2 million. Well, I guess nobody sues for $2 million anymore, but So that's, I feel pretty strong about the insurance program. Other aspect of insurance is it covers all soccer activities. Okay. I'm going to talk about all soccer activities except tryouts, and I'll talk about tryouts. This is for the remainder of the spring, July, and August only. Okay, for right now. All players must be registered and affiliated with their town or club and with Mass Youth Soccer for their insurance to be in force. So if you're going to be doing any activities, once we can start them up again, whether it's June, July, or August, in order for a player to participate, they need to be registered and affiliated. If they were not registered from last September 1, then they need to be registered. If they played last fall, or they registered last fall, or during that season, or even during the winter, if they played futsal, and they're in the records as being registered with your organization, they're covered. There's no additional coverage. Our policy is September 1 to August 31. So we don't have to extend the insurance to August 31. It's in force. It's just that the players and the adults need to be registered and affiliated. So if you're running summertime activities, summer clinics and such, this is what you need to pay attention to. So if you have a child who wants to do some summer clinics with you, but they didn't register last fall, they need to register with you, and then you need to take care of that with Mass Youth Soccer under the normal registration procedures. It could be an ad of 4 or 5 people only. If you decide to do anything at all this summer with high school players, highly unlikely that they registered with your organization last fall. They will need to be registered in order to be covered and participate with your organization. So that's something important to note there. Let me get the tryouts. So in order to make it easy for tryouts, because you may have had a child that moves into town who's never played soccer before, didn't play last fall, and they would like to play this September, and you have a tryout process, you need to do an assessment. All you need to do is have them register with your town or club for tryouts, and hopefully you have a tryout registration process. Tryouts cannot just be walk in and try out. Parents need to either sign up online or sign a waiver to be out there with the organization. And so that they complete a tryout registration and a waiver, they can go try out. If it's a 1-day assessment or a 2-day assessment, you do not need to pay the Mass Youth Soccer $17 player fee for them just to be out there for 2 days of tryout. It's waived. As long as they're properly registered with you, and if an event does take place during that 1 day or 2 day, that hours, which it could, they could fall and hurt themselves, they will be covered by Mass Youth Soccer as long as they're properly registered with the organization for the tryouts. So that's a little wiggle room that we're providing during this phase. And lastly, adults, plain and simple. All adults must be registered, affiliated, paid, and pass all compliance steps, no matter if on the field for just 1 minute. You could be running a summer activity and you've got a parent says, listen, I'll help out. I'll go pick up the cones. If they're going to go pick up the cones, they're out there with kids. Can't do it. It's the same all year long. Anytime an adult's going to be out on the field with anybody, they must be properly registered, affiliated, and paid, and all the compliance steps: safe sport, concussion, national background check, and CORI check. You might have a coach that you would like to bring in to help you with your 1-day assessment. If that coach is not a separate business, a separate sole proprietor, that you are paying a fee to, a 1099 fee, getting a W-9 from them, then they need to go through this process. But if they're a separate business, then they need to take care of this as a business person being in the business of working with children. That's a question you should ask of every business that you bring in, whether it's somebody to help with coaching, somebody to do with assessments and such. Before I get to the fall, any insurance questions, follow-ups to that?
I just have one question from Jay Shapiro, and they were wondering, do we have a version of a waiver pre-written that they can utilize in just in case?
So there is standard waiver language that we've sent out to all organizations. I have to see if we have it up on our website or not. If not, we will we'll put it up under the registration section. It's basically, it's our waiver language that we use for districts, ODP, TSL, and the such. That is standard. We did mail it out to all organizations. We do it usually about once a year, which is standard language that you need to include in your template language that you typically get from your vendor that manages your registration process. So I probably have about 3 people from staff watching this right now writing notes, but we will get the waiver language onto our website under the registration section. So that should be able to get that up in a couple days.
I have one more question, which is more of a registration question, but this is from Sandy Moore. She was wondering, she has Revs coaches who are CORI'd through the New England Revolution. Do I need to affiliate them with Mass Youth Soccer through Sudbury Soccer?
No, you do not. And we have a good relationship with the Revs. They're all copacetic and kosher. The only is that if those coaches are on the sideline with a team at a game, then they do need to go through the Mass Youth Soccer process because they'll be issued a credential. So in essence, it's belts and suspenders with those guys.
And that's it for those questions, Mike.
Okay, thank you. And the fall. So a lot of questions. What's the fall look like? Hey, my standard answer is it's going to get cold, the leaves are going to fall, and it's going to snow before the season's over. All outdoor activities are determined by the Department of Public Health. That's pretty much it. So if we are going in tune with the phases and things are going in the right direction, our fall season should be no different than any other fall season, but under a new normal. The new normal will be most likely the continuation of physical distancing, most likely the coming and going and logistics part for a field. Most likely it's who knows where we're going to be with the requirement for face coverings when out in public and with the capacity to be closer than 6 feet to somebody else. So these are a lot of things that are unknown. But when it comes to sports, we feel pretty comfortable that the sports that our children are going to be playing on the fields will be the sport that they know is soccer. And it's not going to be anything different. I mean, I've got 2 companies right now trying to sell me 2,000 of those bubbles for bubble soccer. It's not going to be bubble soccer. It's going to be soccer as we know it. It's just there's going to be other things that we need to take care of as a society, which will be normalized by next fall. Second part is to prepare for normal soccer activities, as I just said. I just talked about that. And lastly, most organizations, including Mass Youth Soccer, will adjust deadlines based on current circumstances. So this is a question people asked about, well, we typically have people register in the month of April and May. We're collecting money. Are we going to have deadlines? Well, the leagues committee, we were having weekly calls. Now I think we're going every 2 weeks. So the presidents of all the leagues have been meeting on a continuous basis, sharing ideas, sharing concepts as to how we can basically facilitate the soccer experience across the board. And I think you will find that most organizations will adjust their deadline for payment schedules to match the current times. So somebody had asked, should we start registering our children for the fall time? And my answer is yes. Given the way we're heading and given the process that we're moving in, I'd say yes. The what if is always going to be the what if the governor and the Department of Public Health feel that the stats are turning in the other direction, they could put a kibosh and put the brakes on and put a delay and or modify things. But it's what we feel it's best is let's plan for the fall to be normal soccer activities, and then what we'll deal with what comes from the Department of Public Health when it comes. Our hope and desire is that everybody in the state here does everything that they're supposed to do for mitigation plans. And lastly, I'll talk about this, then I'll go back to any other additional questions. A question came up from somebody about the Massachusetts State Referee Committee. What is the relationship with Mass Youth Soccer and the Mass MSRC? Is we are separate organizations. The MSRC is a sub-organization that all 55 states have a state referee committee, or 50 states, there's 55 state referee committees. They report directly to the Federation to U.S. Soccer. They work closely with state associations for both the adult and the youth side. So we don't manage them, we don't control what they do, but of course, we're their biggest customers, so we have a working relationship with them. So whoever asked that question, hopefully that answers that. If you have any further questions about the referee community, what's taking place in the referee community, is go directly to the MSRC through massref.net, their website, or go through your referee director or referee assigner that you have in your local in your local either league or organization. And any more questions about the last two topics or anything else?
Yep, I do have a couple more questions. Paula, well, I have a question from Paula. She's questioning, so COVID's been the focus of this evening, but with last fall's EEE issue, has the EEE topic come up?
So it's no, the EEE hasn't come up because we've been dealing with EEE for a long time now, and that there are standards in place by departments of public health, DPW in various towns, and we still have to follow all the protocols that are given to us by the various towns. Because EEE is not consistent across the state come fall time. So it hasn't been a topic because it's been something that's been dealt with ever since. So, if a town has a EEE issue, typically must be off the fields 1/2 hour before sunset, or any other restrictions and such.
I have a couple questions coming in now in regards to the referees. Pete's asking, in that case, can referees make or demand that their own requirements of players and coaches and fans at games?
Referees can only require what the rules or the laws of the game require and what the rules of the competition require. For example, I'll use the easiest one. Some leagues require that every coach on the touchline has their mask credential out and visible at all times. The referee can require that. Some leagues state it has to be a check-in, and then the coach can then take it and put it in the bag so it doesn't flap around in the wind. That's a rule of a competition. So referees cannot require anything beyond what the laws of the game, the modified laws of the game, and what the rules of the competition require.
Jose Cedro is asking, if towns do not have referee assigners for their in-town program, is there a contact person for them to get in touch with?
Well, first off is that question, if a town is assigning patched referees, they better have a certified assigner. So that's the question, is if the town is appointing officials to cover games in-town recreational that are not patched, then MSRC is not involved in that process. So every league typically has a referee directory or a signer that they can refer to or go to for guidance, or directly to the MSRC, or they can contact by email Russ Wolf, who is the state referee youth administrator. Information's on our website.
I have a question now from Josh Cormier. If will there be, or is there an expectation to establish field guidelines of social distancing for spectators? How can we feel comfortable allowing a typical game to play?
So, well, a typical game can be played without spectators, which is awesome. But yeah, we like to let parents go watch their kids. So we will have schematics and charts that will be provided when we get up to that point, which will show how you can have, like, for example, when we have tournaments at Massey Soccer, MTOC and other tournaments, we have spectator lines right down the side. I know many leagues do it for their playoff. They'll put a spectator line down. The difference be, well, there'll be now hash marks every 6 or 10 feet for where spectators are allowed to sit, so that they're maintaining the physical distancing. And so those schematics will be provided. But you know, when the kids are on the field, they couldn't care if parents are sitting 20 feet apart.
Matt Cotter has a question in regards to the protocols. If a player tests positive for COVID-19, have we discussed what those will be? And he feels that they would this would be particularly important when games actually resume.
So if a child does test positive, there will be all the protocols as provided to us by the current protocols we have right now by the State Department of Public Health, and that you know, it's pretty much, well, our first standard will be that any child that is showing any symptoms, running a fever, anything like that, will not be permitted to participate. So the first screening is by the parent at home, and a part of that too will be if they've been around anybody that has tested positive in the last 14 days, they will not be, you know, the parent will need to keep them. We have to trust what the parent tells us that's taking place. And so that'll be a part of the process. The first screening is done by the parent or the guardian before a child comes to a field. If they do test positive, there is basically, it's the state processes pick up from there, whether it's the state tracing processes that will be in place, but we cannot ask or gather that information. That's a violation of rights.
With some of the new illnesses amongst children, perhaps related to COVID, that have now appeared and started to come into discussion, has any of this been discussed as in return to play activities? Will it affect in negative fashion?
So what's taking place at the Department of Public Health, specifically with the newfound and unidentified, you know, illnesses and or diseases, you know, that certain youth are getting, specifically more in the New York area, is that these processes that are being put into place eventually will basically become general guidelines for when there's epidemics, pandemics, and or a localized spread of a germ or disease. So that is being discussed, but it's not being specifically being dealt with, or not. It's being dealt with. We just haven't gotten the information yet.
Okay, and the last question here from Greg. Is there going to be, what is the official mechanism to receive notifications on the official clear from youth soccer and the mandates / updates?
So the process that we use is probably the same way you found out about this tonight's webinar, is that as long as your leadership report is up to date, we send out constant contact emails to leaders. And those are the presidents, vice presidents, registrars, secretaries, treasurer, risk administrator, and the such, that we will we have a leadership email that goes out. If anybody ever got one of those and they went down to the bottom, they hit unsubscribe, by law, they're taken right off our list. So please never unsubscribe from one of ours. If you don't like the content, just delete it. Don't unsubscribe. But that's how we keep it up. At the same time, then we post notifications on our website. And if you go to our website, you'll see that we have rolling banners of the latest news that's taking place, as well as we do have a COVID-19 section for news as well.
That's it.
Well, let me do one last screen share to see if it's properly queued up. I most certainly hope it is. Can everybody see my screen of wash your hands? Tammy, can you see this?
I see Baby Shark, I think.
Oh, well, there we
yes.
go. There we go. Hey, everybody. Just want to say thank you very much. We appreciate you all. And, if there's anything else, all right, that is going to be in your mind all night long. But hey, everybody, thank you very much for everything that you do. Thanks for being with us tonight. The questions were phenomenal. You know how to find us. Email us. Any follow-up, please let us know. We're just trying to deliver as much content as possible during these crazy times. But do us a favor, take advantage of what we have provided. The top techers, the esports, the coaching conversations, the coaching courses, the backyard games on our website. It's amazing what we have so that we can make sure that our children, come through this, on the opposite side, healthy, vibrant, mind, body, and soul in the right place. And sport is the best medicine. And so we thank you for being a part of it. Everybody, again, you are incredible. Thanks again. Take care. All right, I'm going to have to pick it up from here.
Oh my God. I'm gonna go to bed singing this song, right?
Am I driving everybody away? What are we down to? We're down to 53. Come on. I got 53 people who want to put up with this.
Everybody's thanking you.
Your elbow.
Cough into your elbow.
All right, I know this is going to be replayed on social media by somebody, and I will be in trouble. Out of here. Good night, everybody.
Thank you.
Good night, Mike.
Good night.
Good night. Good night. Thanks, everybody.
Bye, everybody. Thank you for tuning in.